Hey guys, how you going? My name's Leki.
And I'm Aarvi.
Welcome back to another segment of our podcast. It's called The Trenches, where it's in-house chat. So in a moment, we're going to be introducing some new team members that have jumped on board. So you may see them in future podcasts. But right now, you've got Leki and Aarvi driving the ship, okay? So today, the theme within The Trenches is top three, okay? And Aarvi and I were talking about, okay, what would be a good topic to talk about today in terms of our top three theme. And we jumped back into our online patient management software. We use Clinico. And we were able to find out what is the overwhelming type of injury that we treat and in a typical sort of week. And overwhelmingly, number one is low back pain. Okay. Number two is shoulder and neck pain. And number three are knees. Okay, so we thought we'd dive a little bit deeper into what that actually looks like. And Aarvi will take over with the first one, low back pain.
All right, so the first one, as Leki mentioned, is low back pain. So low back, let's put an example. So in a day, we'll probably get let's say 4 people come into the clinic. One person may have more of like a disc kind of pain, and it's more because they do too much bending and too much sitting, and whenever they do those movements, it sort of irritates them. And sometimes they can get like a pain or down the legs or something like that, a bit of referral pain. Or someone's come in and we, through our assessments, we find it's more muscular. So there's muscles around the back that's just tightening up, and they keep causing like spasms and stuff like that. And the third person, when we do our assessments and all that, and we find it's more like a facet, so it's like more of a bony issue. So it's like a facet which comes from like overuse, so it keeps tightening up and jamming up, and then whenever they do those kind of, especially rotation kind of movements, it really gets stuck and jams up. And then there's 4, it could be multi, so it could be all those things combined, leading up to one big, real bad, naughty back. And then, looking into that, we assess and work out what it is, and then we go from there and try and base our treatments off there. And most of the time, what we do find, especially with low back, is that it's usually two different areas, two areas combined that usually let the low back down. And what we notice, it's usually the big glutes and the core, so the spinal stability, which is the core muscles. So the core is not just the front; it's also the obliques on the side, the smaller back muscle at the back, and even the lats are part of your core. And then the big glutes, the big driving force, are the strongest muscle in your body, so got to have them nice and strong. And most of the time we do notice, it doesn't matter which condition it is with low back, we notice that the reason they get low back is because low back's been doing all the heavy lifting for them, and usually the low back's very strong and it's done all the heavy work, and the other two areas have been on a holiday and haven't really done much. So they're the common injuries through the low back, but they all come under the umbrella of low back injury, and we see a lot of them, I'd say. So that's probably why it's number one.
Absolutely. So, with that, it can be kind of like a chicken and egg sort of thing, or an egg before the chicken, in the sense that you may come in with an acute disc pain, and what I was describing is the disc became angry because the overarching muscles that help support your spine haven't been there to do the work for you. So then over time, you might get some osteoarthritic bony pain, so the facet gets worn out and rusty, and then ultimately this gets really upset. Okay? Or maybe you had a car accident. Obviously you had an acute injury, then you blew your discs out because it was a really nasty car accident. But overall, for those 4 types of patients that Aarvi's describing as an example, the way that those back pains come in may vary, but the story comes back to that same thing. What's your conditioning? What can your parts and pieces do for you to keep you up and about? Okay? That's pretty much the summary there. So, great work. The second thing is neck and shoulders, okay? So, let's go with the 4. Say that in another day there's 4 people that come in, and across our list we can see that they're coming in complaining of a shoulder pain. A shoulder pain could be a rotator cuff tear. That's a pretty common term. Could be bursitis. There's another buzzword. It could be like weird tightness around and stiffness, burning pain around the base of the shoulder blades, like kind of around the bra strap level for the ladies. It may be in terms of neck pain, tightness in the upper traps there. Really a lot of stiffness in the neck. You might wake up on the couch there because you fell asleep dead tired. Wake up the next morning with a wry neck. You can't look one side to the other. So all these sorts of problems can be presented as a shoulder or a neck problem, And our job here is to put you under the microscope and figure out where the primary cause is, so that we can help you out and get you back to your normal 100%. So it may also, a big part of this subset of an injury is headaches. Heaps of neck related headaches, where if there's problems, where the smoke is what you're feeling, the headaches, the neck pain, but the fire may actually be somewhere else. It might be around the back of the shoulder, might be this big postural girdle that's letting you down, which is why you're getting overcooked in the neck and the head. So overwhelmingly in our patient records here, shoulder and neck is a big subset in terms of our top 3 types of injuries we see. That's a big subset of the injuries that we see.
And like we discussed with the low back, it all comes down. The shoulder and neck follow the same line, and they all come in together. And then we got to follow the same ship to steer it towards the rehab wise. And it's usually always something. So it's always strengthen what's weak, not strengthen what's already strong. And that's what we usually find, especially through our assessments. So most of the time, you may have an injury up here in the upper trap, like Leki was describing, or the rotator cuff. And it's usually because that muscle or that area is working too hard. And so there's no point strengthening what's already doing the heavy lifting. Might as well find what's weak and trying to make that stronger. And it's usually what most of the time could be the lats. If it's like a rotator cuff injury, it's usually the big lats that aren't doing much of the heavy lifting, and so on from there. So that was our number 2. And then we go into the third one that we find. It's the knee. So the knee, so let's look at it. Let's take 2 examples. So usually we get people coming in straight into the clinic from like a sporting injury. They got a whack to the knee, and then they take impacts, land awkwardly, and then we do an assessment. And most of the time when that kind of injury, we do find most of the time it's due to the ligaments, especially if it's direct trauma to the knee. And then the other case is we get people coming in and they've just had ongoing chronic knee pain, and most of the time the scans usually show it's a bit of wear and tear, osteoarthritis as the term you may know, in the knees, just because overuse, just overly every day, just putting stress on the knees, and then we got to strengthen from there and go from there. And same goes with the knees. They all come and lead to like one ship and try and get the rehab going from there from one side. Yeah.
Yep. So in short, these are, for the number of people that we help throughout the week, right? The top 3 injuries that we see, we'll always see a lower back in there. There's always a couple of new patients throughout the week, and they're coming in with acute, brand new low back pain, okay? Or it might be someone that comes in with a chronic back injury, okay? There may be someone else that comes in and they got this knee pain, they came out of nowhere, but over time it slowly went the wrong way. And then, there might be a game of footy on the weekend, someone comes in with a fresh bung knee. What is the program or what's the assessment that we go through? And because of what we saw when we tested you out, asked you a few questions, then we describe a rehab program, some homework for you to complete so that you can get yourself back to being 100%, okay? Now, a lot of this work comes back to, despite all these different types of injuries that you've sustained or the mechanisms of how you became injured, whether it's low back, neck, shoulder, or knee, we always come back to this one ship that drives the management plan, okay? And we've given away a lot of our best stuff for free because we believe this is something that everyone should know, okay? And so Aarvi's put together a chain of blog posts, which is what we're going to do with you anyway if you're in the clinic. So if you have neck pain, if you have shoulder pain, if you have headaches, we've already given you the answers. So you can preemptively help yourself with Aarvi's good work, because he's learned from some of the best minds there, and we're spreading the gospel of strength training as part of our rehabilitation plan, okay? So to this video, we'll have the links to the blog post there, and it goes through a lot of the bits and pieces there for low back pain and knee pain. We would give this same type of exercise protocol. If you have an upper shoulder, neck, headaches, postural pain, we have a system of programming that we give to people in the clinic, okay? So free education, okay? Save yourself some money. I know, there's a lot of expenses and things out there, and we're all about trying to help the people around us, okay? So we believe in good karma. If we give you good things there to help you be healthy, then you can help your community with the things that you're passionate about, and we're happy to help you guys out.
And just to add on, like the things I've put together, just to break it a bit more. So especially with the shoulder, the neck, I would be looking at, if you got those kind of pains, I'd be looking at the part 3 of the activation series. And if it's more the knee or the low back, I'd be looking at the part 1 and part 2 and trying to incorporate them if you got those two. Because like we mentioned, the big hips, the glutes are the big driving ship, and if they're nice and strong, the chances of you decreases the chances of you getting knee injuries and low back. And then shoulder and neck is more strength in the big postural muscles up behind. So yeah, just have a check it out. Check out his activation stuff. Put it out for free, like Leki mentioned, and so saves you coming in and seeing us, and then we can go on from there and make your exercises more advanced after that.
Absolutely, it's about making healthy simple.
That's it.
All right, guys, that's us. We'll see you guys next time.
All right, see ya.